I'm Jeffrey Snyder, and I am a cardiothoracic surgeon. I have been doing that for 32 years. I've been the chief of cardiac surgery here. We do about 200 cases a year. I have started prescribing ROM therapy, and my partner has also started enrolling people as well.
I see a pulse rate of 75 beats per minute in a normal sinus rhythm, which is great.
We had an inpatient cardiac rehab program at our hospital, and we had an outpatient cardiac rehab program, both of which went away with COVID. So we were left with no cardiac rehab programs for our patients, and I was made aware of ROM therapy and then was talking to the people at ROMTech about how to get that instituted here in Tallahassee. So far, the results have been extremely good. If you compare ROM therapy to an inpatient rehab program, the compliance is much better so far with ROM therapy. And inpatient rehab programs, typically 80% of the people don't actually complete the entire program, so they don't get the full benefit of the program. With ROM therapy, it's so much easier. It's in home, they feel good about it, and they're safe, and the compliance has been much higher.
I'll quickly have you run a blood pressure for me if you could by tapping that button on your screen.
Anytime they're using ROM therapy, they're monitored with a live person monitoring their heart rate, their EKG tracing, their oxygen saturation, and visually seeing them. And that's the big difference between doing it on your own and ROM therapy, is the monitoring of your activity and the safety that the monitoring provides.
So today we're going to move from resistance 3 up to resistance 4.
I have been very involved in monitoring these people myself. So I call them and ask them, what is your satisfaction? And do you feel like it's doing you some good? So far, the patients that have been using ROM therapy are very happy with it, number one. They feel like it's making a big difference, number two. And they see that over the course of the 12-week program, they have a much better endurance. Their exercise tolerance is better. They feel safe, increasing their activity, and they're much better off. And a lot of our patients live 20 or 30 or 40 miles away, and they really appreciate the fact that it's in their home and they don't have to get in their car and drive to a hospital 3 or 4 days a week to have a safe, effective cardiac rehab program.
Have you been able to start to incorporate some of those walks that we talked about doing on your lunch break and things like that?
I have, and you'll be so proud of me. I've gone 3 times this week.
I feel so strongly about the success of this program so far and the potential for it that I have called my colleagues in Fort Walton and Pensacola and told them I was doing this, and I want to go talk to them about it and let them take a look at it and see the results that we're getting here with our program. And I think they would be enthusiastic to recommend it to their patients.